1 in 20 Australians, that's 1.5 million people, lives with diabetes. That is a number which continues to increase. Unfortunately and terrifyingly, this country now faces an epidemic of diabetes. Type 2 diabetes is by far the most common form. In Australia, it is much more likely to affect people of lower socio-economic standing. They're people who often have less access to clean water and affordable fresh food, less time and less space for regular physical activity, and often less access to good quality health care. In particular, First Nations peoples globally, but particularly in Australia, have a frighteningly high incidence of diabetes. They develop it at a younger age, and their progression to often life-threatening complications is frighteningly rapid. Diabetes is the leading contributor to the gap in life expectancy between Indigenous and non-Indigenous Australians. Aboriginal and Torres Strait Islander people are nearly 5 times more likely to be hospitalised for diabetes-related complications. Diabetes is the leading cause of death for Aboriginal people in the Northern Territory. The reasons for this are complex, and they include both genetic predisposition and a whole raft of socio-economic factors. But many of our policy settings could be adjusted to immediately improve protections for First Nations and other vulnerable Australians. The first of these is the urgent need for action on our diet. Australians eat too many ultra-processed foods and too many foods with added sugar and hidden chemicals. Unhealthy foods represent a third of Australian children's diets. 1 in 4 Australian children is either overweight or obese. Most Australians just don't understand how much sugar is added to our food. The regulation of food manufacturers in this country is rubbish, whether we're talking about dietary codes for infant formulas or the health star ratings that we apply to other foods. Parents often think that they're feeding their kids healthy food, but products which are labelled as containing no added sugar can still contain added sugars in the forms of gels, pastes or purees. Only 22% of the infant and toddler foods stocked in Australian supermarkets actually meet nutritional standards of the World Health Organization. In particular, many breast milk substitutes, or what we call toddler milks or toddler formulas, are effectively just sugary drinks. Labelling codes for those drinks and for other foodstuffs in this country are voluntary. Only 41% of products on our supermarket shelves display health star ratings, and there's a reason for that. The manufacturers of healthy products use them as a marketing tool, but others, the unhealthy foods, just decide not to display a score. The star system is also problematic in and of itself, though. It doesn't distinguish between natural sugars and added sweeteners. It actually gives higher ratings to ultra-processed foods and lower ratings to whole foods. We urgently need a mandatory food labelling scheme which will be able to provide accurate and clear health information to consumers when they buy food for themselves and for their families. Now, the Health Committee also recommended that the Australian Government should implement a levy graduated according to the sugar content of sugar-sweetened beverages. These are sports drinks, soft drinks, energy drinks, vitamin waters. These drinks cause weight gain, but they have limited nutritional value. They carry calories, but not much else. A levy on these soft drinks would encourage industry to reformulate those drinks, and it would lessen their consumption in the same way that similar measures have decreased consumption of tobacco and of alcohol in Australia. More than 35 public health organisations have now asked the government to do this, to levy a sugar-sweetened beverage tax in this country, but the major political parties, sadly, are not listening. Data from 85 international jurisdictions has shown that that sort of levy is effective in decreasing sugar consumption. In fact, a recent study in the US showed a 40% decrease in gestational diabetes and a corresponding improvement in obstetric outcomes like low birth weight after imposition of a sugary drink levy. And that was within a couple of years of that intervention. Gestational diabetes is a real worry for Australia because it affects not only the women who have it, who are at increased risk of developing type 2 diabetes in later life, it also has permanent and ongoing implications for the children who sit in the mum's tum while that mum has diabetes during pregnancy. So earmarking the revenue from the levy, a sugar-sweetened beverage levy, would be an immediate way of identifying funds which could help with public health measures, and that would help engender public support for this concept. Deputy Speaker, it was a great privilege to be a member of the parliamentary committee which investigated diabetes in Australia, but I have to say that much of what we heard was confronting and difficult. And it's very clear that this scourge is something which is going to be a huge challenge for all of our healthcare systems in the years to come. The efforts of that committee will be wasted if this government does not act on the committee's findings. The committee visited some First Nations communities in which we saw people with minimal access to fresh fruit and to vegetables, people who couldn't access affordable drinkable water. We saw communities where children were carrying around 2-litre bottles of Coke because it was cheaper than the bottled water, that was the only other source of fluid that they could access. We could help those people, those communities, in the simplest and most fundamental of ways. We could improve the regulation of the food and drinks industry in this country. But if we don't, we will all bear the cost of that and the loss associated with this plague that the diabetes epidemic represents.